diabetes, having elevated glucose will lead to reduced tissue oxygenation. So we're not getting that great oxygenation to those tissues and to that incision site. And that will reduce the white blood cells at that incision site again, which is, we want those white blood cells there. It can lead to a prolonged inflammation, reduced levels of growth factor, which we really need for that healing process. And it can cause some dysfunction of angiogenesis when we have those new blood vessels forming. So lots of problems with healing when we have diabetes. And when we think about diabetes as a whole, we know that folks that have wounds, especially on the lower extremities, tend to have a longer or more difficult time healing. So this does carry over to any sort of intentional wound, i.e. surgery or incisions. Now, this study looked at folks who had a single level lumbar decompression surgery who also happened to have an A1C in their records. And they looked at the risk of infection and the A1C. And as you can see kind of on the scale here on the left, that once the A1C hit about 7.5, there was an increased risk